The numbers are out. In 2016, 914 British Columbians died of an overdose. It is astonishing how this plague has cut a swath through every community and every social group. Many parents are terrified that their children live in a world where one bad decision can result in death. As happened during the AIDS crisis, St. Paul's Hospital has stepped up with compassion to serve those in need. People like Evan Wood, Thomas Kerr, Julio Montaner are carrying a great burden to help guide us through this crisis. Working with them is our next guest. Our society needs him and St. Paul's more than ever. Please welcome Keith Ahamad.
Thanks very much, Sam, for that lovely introduction. I think before we get started here tonight, can I just get the lights up in the salon here to help? I'd like to just have you look around the room here to help frame what I'm here to talk about tonight. As you look around the room, I think the salon here holds about 650-ish people. Imagine we were to add another 300 or so sitting on your laps here tonight. 3/4 of those people would be below the age of 50, half of them below the age of 40. 80% of them would be male. If you look around this room tonight, I promised myself I wouldn't get worked up. I only have 7 minutes, I can't cry. If you look around this room tonight, by the end of the year, all of you will be dead from a preventable and treatable health issue. And the vast majority of you will have been exposed in adolescence, when, quite frankly, the choices we make are hardly an informed choice. We find ourselves now in a public health emergency in British Columbia. An unbelievable thing to think about. As Sam said, my name is Keith Ahamad, and I'm an addiction doctor. I work in St. Paul's Hospital in downtown Vancouver, and I'm also a researcher at the University of British Columbia and at the new, soon-to-be-announced, BC Centre on Substance Use. As Sam said, when I moved to Vancouver in the mid-90s, we were in the middle of a health crisis related to HIV, and remarkably, almost 20 years later, we find ourselves again parked in the middle of a public health crisis, a public health emergency, specifically related to unintentional overdose deaths caused by a toxic, illicit drug market. So many people that I meet want to know, okay, well, why can't people stop using drugs? It's so risky. Why wouldn't you stop? How did we end up in the situation that we're in now? And what are we going to do about it? Is addiction a choice? I think for the vast majority of us, it's so difficult to understand because substance use is hedonistic and voluntary for most of us. The reality of addiction, as it's defined, is a compulsive disorder. The inability to stop using drugs despite the face of serious health and social harm. Why can't people stop using drugs? Well, there's this very interesting primitive part of the brain called the reward pathway. We spend time with our children, the people that we love, we have sex, we drink water when we're thirsty, the reward pathway gets turned on, and evolution has carefully shaped that part of our primitive brain to say, do that again. It's really important for our survival of our species to pass on our genes. Drugs of abuse, drugs that lead to addiction sneak into that primitive part of our brain, hijack it, and make those substances seem significantly more important than what most of us would put a great deal of value on. How did we end up in the situation we are in today? Specifically with respect to the opioid overdose epidemic, it is true that my colleagues Our culture has become too reliant on these medications when the evidence is very clear that they cause a lot of harm, including overdose death. And there's really not very good evidence to support their use to treat chronic illnesses like chronic pain. But it's not that simple. It's much more complicated than just physician prescribing. The issue is that untreated addiction manifests itself as harm. And specifically, in the case of opioids, it's overdose death and striking overdose death in young people. For cigarettes and smoking, it's lung disease and cancer in 30 years. For an untreated alcohol addiction, it's liver disease, brain disease, heart disease, cancer. In the acute intoxication, it's motor vehicle accidents, spousal abuse, missed work, all preventable and all treatable. Unfortunately, addiction has been totally neglected and disregarded for decades by the healthcare system. To say that we have a system is broken is not fair. In fact, we don't have a system. We need to build a system from the ground up. Healthcare professionals have not been educated on how to prevent addiction, let alone recognize it, diagnose it, and treat it in an evidence-based way, creating this huge gap in the healthcare system. This gap has been filled by peer support and sometimes unskilled lay people, and to their credit, some of them are doing excellent work. Unfortunately, some of them are also exploiting this patient population. So it's a patchwork of neglect, exploitation, and excellent work. And I'll tell you, as a healthcare professional, it's very difficult to navigate this system, let alone somebody with a substance use disorder. So how are we going to change the system of care to right this ship out of a public health emergency? We don't have to look very far, as Sam alluded to a public health miracle, really, that happened in our backyard here in Vancouver. As I mentioned, in the 90s, we had a public health crisis related to new HIV infections in Vancouver and AIDS-related death. Actually, the worst HIV infection rate seen outside of sub-Saharan Africa at that time. And through this epidemic was the creation of a center that created the blueprint to bring together education, clinical care, and research. And through that center, the Center for Excellence in HIV/AIDS, we subsequently saw a reduction in new HIV cases by 90%. Ultimately, seeing a decline in AIDS-related deaths to a point where 2 years ago, remarkably, we closed the AIDS ward at St. Paul's Hospital. With the resolution of the HIV epidemic, the architects of this system have seen the persistence of problems of untreated addiction amongst those who acquired HIV through opioid addiction and heroin addiction. Over the years, they have been developing the foundational structures of which I'm very proud to say I'm a key part, to allow the creation of a new center, the BC Center on Substance Use, to make BC a world leader in addiction care. We are now building the momentum to bring together the academic community, healthcare professionals, community leaders, and treatment and recovery to create a system to prevent the harms of addiction and give people the care that they deserve. I know so many of us have been affected by the harms of untreated addiction, including this public health emergency, and I leave you with the thought tonight, for those of you that want to get involved, for those 914 people that died last year that will never hear that remarkable choral singing, for any of you that want to get involved in the work that we do and support us, I'll be here all night. Thank you for your time.